During the last week, runners should focus on final preparations, good nutrition, good hydration, sleep well, and tapering their training. So race week is not a time to be making up for any training disruption in those last few weeks. It's very normal to feel aches and nerves before competing in the marathon, particularly for your first time. It's natural to have a level of apprehension about running 42 kilometres. It's a big undertaking and it's a significant challenge. Runners should be concerned if they're feeling unwell or haven't done enough preparation to prepare for the challenge in front of them, but nerves alone is not something that should stop you from enjoying your experience. Nutrition and hydration are really important in race week. They set you up for a great race day. It's important that you stick to your plans and have adequate nutrition and hydration without overdoing it. Some simple do's and don'ts. Follow your plan. Have your plan set well in advance and don't go to extremes. Race week is not the time to be trying to add in new practices and routines. It's also not the time to be trying new foods. Stick to what works for you. Things that you've tried during your training and have used several times before. Leading up to the marathon and during the marathon, there are some warning signs that you can keep an eye out for. Particularly diarrhea and vomiting or other forms of illness such as fever are things that you should be aware of. It can be unfortunate that you feel unwell in the lead up to or during the marathon, but if it happens, we ask you to seek assistance from the medical team and reconsider your participation in the event. If participants start to feel unwell during the race, they should stop at their first convenience. There are medical posts and medical teams across the entire course. There are more than 800 medical personnel on site for your well-being. Please feel free to seek out their assistance. They're there to assist you. With variable weather conditions in Sydney, participants are best to prepare focusing on their own physical and mental conditioning. As the event gets closer, we monitor the expected conditions on race day, and in the lead up to race day and during the marathon, if there's any change in conditions that might impact your participation, we'll communicate that with you. Participants should familiarise themselves with the event alert system. This is a communication tool that we use to be able to pass quick, clear information to you about the conditions you can expect on race day. The colour flags will indicate the conditions that you're preparing for or experiencing. For example, a green flag means you've got ideal conditions and there's no need to reconsider your plan for the race. If conditions deteriorate, you might see the colour of the flag change, and then accordingly, we ask you to adapt your race plan. If you're feeling ill or unfortunately injured during the race, we ask you to stop at one of the medical posts located every 2 kilometres along the course. If you're unable to make one of those posts, there's a team of more than 600 people available between those posts for you to be able to seek assistance from. We'd encourage you to stop when you recognise those signs, then continue on. The best advice we have for immediately post-race is to keep moving. And for the next 24 hours, your recovery will be a lot faster if you keep moving and keep active. We understand that you're going to feel sore. You've worked hard for that soreness. Please celebrate it, please enjoy it. It's best to stay away from non-steroidal anti-inflammatories as these can inhibit your recovery. During race week, little niggles are common. Please don't ignore a little niggle in the heel, Achilles or foot. Even a quick check with your podiatrist during race week can make the difference between finishing strong or falling short of your objective. Having the right shoes and gear is really important. 1 week to go is not the ideal time to be changing your shoes or your equipment. We'd encourage people to be doing this a lot earlier in your training program. If, however, you have a problem with your shoes or equipment, it's better to make the change as soon as possible. When checking your shoes before race day, it's important that your shoes are well worn in, but not worn out. If they're worn out, it's best to change them now and get a few runs in before race day. Look for a thumb width spacing between your toe and your shoe. That will allow for swelling and to prevent nail trauma. Some important foot care essentials for runners to apply before the start include rimming nails straight across and having any calluses professionally removed before race day. You don't want to be making any big changes close to race day. If you get a blister at the early stages in the race, we ask you to stop and do something about it early. There are medical posts every 2 kilometres. Stop in and the team will get you back on your way sooner rather than later. It's better to deal with the blister early and prevent it from becoming a bigger issue. Taping your feet can be advantageous in helping you get to the finish line. For runners that taping their feet might be of benefit, we encourage you to do that early on. Race day is not the time to be doing it for the first time. A couple of quick things for participants to do on race morning to look after your feet and getting through the 42 kilometres. Check that your laces are secure but not too tight. Do a quick mobility warm-up for your feet and ankles before you hit the start line. Prevent blisters with perfect fit shoes, moisture wicking socks or toe socks for extra protection and a pre-race layer of anti-friction balm on common hotspots. For areas prone to rubbing, apply zinc oxide tape or a thin hydrocolloid patch before running and keep calluses reduced.